Hello, Bobcats. My name is Dr. Royce Smith, and I'm your Dean of the College of Arts and Architecture here at Montana State University.
And I'm Dr. Kristina Hool, Doctor of Hematology and Oncology at Bozeman Health Cancer Center.
We wanted to connect with you today to tell you a story about why the use of face coverings and masks and the practice of social distancing are so important in our community right now.
While medicine has made progress in managing COVID-19 infection, prevention is still the best way to protect against an infection that doesn't have a vaccine or a foolproof treatment.
A year and a half ago, you probably wouldn't have recognized me. In February 2019, I was diagnosed with an aggressive form of non-Hodgkin's lymphoma. In the span of just a few months, the cancer had taken over my lymphatic system and spread to my spleen and the bone marrow of my pelvis. That's how Dr. Hool and I met. She became my attending oncologist and sent me urgently to Seattle to begin the first of 6 rounds of chemotherapy. She oversaw my treatment and helped me achieve remission from a disease that nearly took my life.
Dr. Smith is a true warrior and fought cancer bravely, knowing the risks and side effects of treatment. Our community is filled with individuals who have battled or are actively battling cancer. You might see these people in a store and have no idea that they are fighting for their lives. They have no choice but to accept treatment in order to survive, even when the treatment causes significant risk for infection during a global pandemic.
I lost a bunch of weight, lost all of my hair, including my eyelashes and eyebrows, and was given a diet in which I couldn't eat blue cheese, mushrooms, or sushi because along with the cancer, the chemotherapy destroyed much of my immune system and left me weak and vulnerable to infections that might be caused by the foods we most love. I took doses of antibiotics, antifungals, and antivirals every day to prop up my immune system, and every day I dealt with the fear that I might catch a cold or the flu and not be able to recover from it.
This is a common issue for patients who are treated for cancer, and a fear that is not uncommon or unreasonable. When you are on cancer therapy, infections you have had before or never had to worry about have a newfound ability to put you in harm's way.
Today, patients that are fighting the same fight that I survived now worry about COVID-19 and the fact that they might not have the immune response required to battle it and cancer.
You are absolutely right, and facing both these risks together can be overwhelming and frightening.
How do you think my immune system is doing now, Dr. Hool? Do I still need to be concerned about COVID-19 and the impacts it could have on my health?
While you are definitely cancer-free and doing fabulously well, the effects of cancer treatment on the immune system can be long-lasting and can extend to a year or even more after treatment ends. Even when we look and feel like our normal selves again, our true ability to fight infection or respond to a vaccine might say otherwise.
Do your patients who are battling cancer now also worry about contracting COVID-19? What can happen to cancer patients if they contract the coronavirus?
Our cancer patients worry very much about contracting COVID-19. They are afraid that if they get it, they won't survive. They have to make the difficult decision every day to come to our cancer center for treatment when they would prefer to be safely quarantined at home. There are studies that tell us that cancer patients can be at higher risk for more severe outcomes or complications of COVID-19 infection, including death.
What can we do as a community to curb the spread of COVID-19? Why do you think Montana State University and the Montana University system made mask use a requirement on campus?
We follow local, state, and CDC guidelines to help us minimize risk in our community. It is absolutely clear that the best way to do this is by social distancing, hand washing, and wearing a face mask appropriately.
So you mean like this?
No, Dean Smith.
How about like this?
No, Dean Smith.
How about like this?
No, Dean Smith.
How about like this?
Much, much better.
I know some university students and younger people have heard about COVID-19 and thought that it's a disease that's really only serious for older people, like me. or people who have pre-existing conditions. Is that true?
We are most certainly not old. And truthfully, we should not assume that our age will protect us. Yes, older COVID-19 patients with more medical issues may be more likely to have a severe case or die from COVID-19 infection. Most young patients will do well, but there is not a guarantee. While the number might be smaller, we have seen severe cases and unfortunately also deaths, even in the young.
From walking with you in my own battle against cancer and safeguarding against the infections along the way, I trust you implicitly, Dr. Hool. So, what is the best advice you can pass along to our Bobcats as they pursue their studies during a pandemic?
This is absolutely our opportunity to be better together and to make a statement that we care enough about others to wear a mask in order to protect them. Remember that we can have infection and not be aware, and could unknowingly spread infection to the vulnerable among us. Wearing a mask in a public setting is especially important in situations like lectures or meals, where it is difficult to maintain the appropriate 6 feet for social distancing. Spreading infection would be much more likely in these settings without masks. Masks are a great idea, and even better if we all wear masks together.
There you have it, Bobcats. I'm here at work because I love my students, my faculty, my staff, and my MSU community. But I hope you'll do your part to keep yourselves safe and to keep me safe. I wear my mask for the elderly mother I take care of at home.
I wear my mask for my patients, old and young.
Who do you wear your mask for? Remember that the best way for us to stay together and get through this is to always wear a mask when inside buildings or around others, and to maintain social distancing of at least 6 feet whenever possible. Also, use those Clean Cat kits you were given at the beginning of the semester to wipe down surfaces before and after you've used them, and to keep your hands sanitized throughout the day.
Dr. Smith is absolutely right. With a new infection still waiting for a vaccine, prevention is still absolutely our best bet. Masks, 6 feet distancing, and hand hygiene protect others and tell others, yes, I care. I will wear my mask for you.
Go, Cats, go!